wabarakatuh. Hello everyone, I hope you're having a good day. So in the recent years, there has been a growing interest in the patient-centered outcome of treatment. Several cohort follow-up and prospective longitudinal type of studies on the patient-centered outcomes have been established. One systematic review by Souza in 2017 who assessed the quality of life after root canal treatment and showed that 97% of the patients were satisfied. However, until now, there are no studies that assess the quality of life after full pulpotomy in teeth with irreversible pulpitis. Vital pulp therapy has been increasingly practiced as an alternative treatment option to the root canal treatment, and since the conventional root canal treatment generally requires a more complex armamentarium, it's time-consuming, might require multiple visits, and because of its high cost, especially for those disadvantaged members in the society, they often avoid dental treatment and prefer to extract the tooth instead. And although full pulpotomy is proved to be a promising alternative treatment option to the conventional one, the evidence lacks a clinical trial comparing between both treatment modalities. And in the absence of a clear-cut clinical criteria, the question is kept open to debate which treatment is superior. And based on this randomized controlled clinical trial by Taha and her colleagues study, which was published in April 2023, was focused on the one-year outcome comparison between full pulpotomy and root canal treatment, especially in mature permanent teeth with irreversible pulpitis in terms of treatment outcome, pain relief, quality of life, and patient satisfaction. Study design was a parallel double-blind randomized controlled trial. Note that double-blinding is when neither the person doing the assessment nor the participant could identify the intervention being assessed until the clinical trial is over, which makes the results less likely to be biased. Other statements that have been used for double-blindings are active placebos, identical placebos, or dummies. In the study, they gathered a total sample size of 60 mature permanent molars, upper and lower first and seconds, and then they were randomly assigned to two groups, either the test group, where they performed pulpotomy using bioidentine of 4 mm thickness followed by composite restoration, or the control, the conventional root canal treatment group. Allocation concealment was performed by a researcher assistant using sealed envelopes that were opened immediately prior to the interventions. The operator was blinded to the type of the intervention until the pulp was exposed. Pain scores were recorded on a 0 to 10 visual scale analog every 24 hours for 7 days after the treatment. Preoperative per-epic radiographs were taken at repeated times at 6 and 12 months period of follow-up. And for the first parameter, which was the quality of life, the instrument was quoted from the Oral Health Impact Profile developed by Slade and Spencer, modified by Dugas in 2022, which included 17 questions. These questions covered 7 conceptual aspects of oral health that were assessed before and after the treatment. And for the results at 1 week and 1 year, all patients in both groups who had some impact before the treatment showed improvement in their scores without any significant difference. For the next parameter, which was the patient satisfaction, the satisfaction was measured by 7 differential scales, which determined the degree to which the patients were pleased with the treatment provided in terms of cost, time, pain during the procedure, aesthetic, chewing ability, the patient's perception, how pleasant was the treatment, and their overall satisfaction. They were asked to fill quality of life and patient satisfaction forms in the follow-up appointments. And for the results, the overall satisfaction rate was high in both treatment modalities. However, satisfaction with the pulpotomy group was significantly higher in terms of time involved, intraoperative pain, and pleasantness, and finally, of course, the cost. The third parameter, which was pain, this line graph presents the mean pain scores at day 1. The treatment in the pulpotomy group was significantly lower than the root canal treatment, and at day 2, 3, and 5, the pain levels were still lower in the pulpotomy group, but without any significant difference. And the root canal treatment group then started to gradually decrease, reaching the pulpotomy group. And the pulpotomy group had a significant lower percentage of patients taking analgesics following the treatment compared to the root canal treatment group. For the last parameter, which was the outcome, cases were considered to be successful in the absence of swelling, sinus tract, pain, tenderness, mobility with a normal healthy periodontium, and absence of radiographical signs of periapical lesions. The overall success of the treatment based on the clinical and radiographic evaluation The results showed that at 1 year follow-up, 27 out of 29 in each group were successful with a 93%. This brings us to the conclusion of the study that full pulpotomy is more efficacious in relieving pain compared to the root canal treatment and has higher patient satisfaction with the treatment time, cost, intraoperative pain levels, and therefore it can be used as an alternative option to root canal treatment in mature permanent molars with irreversible pulpitis. And of course, we still need further additional clinical trials to assess the long-term outcomes of vital pulp therapy in order to make a solid clinical application. Thank you so much for listening. I hope you have a good rest of your day. Bye-bye.